Ah, pregnancy. That magical time of glowing skin, luscious hair, and yeast infections? Yep, you read that right. While not exactly glamorous, yeast infections are about as common during pregnancy as cravings for pickles and ice cream. But don't worry, this isn't a sign that something's wrong. It's just your body doing its pregnancy thing. Consider it a minor detour on the exciting road to motherhood. You see, pregnancy is a time of major hormonal shifts, and these changes can sometimes tip the delicate balance in your body, making it a haven for yeast overgrowth. Think of it like this. Your vagina is usually a well-balanced ecosystem, but pregnancy hormones can sometimes act like a sudden heat wave, creating the perfect environment for yeast to multiply. But fear not, because knowledge is power. By understanding what causes these pesky infections and how to prevent them, you can navigate this common pregnancy woe with confidence. So let's unravel the mystery of yeast infections during pregnancy together. We'll explore the science behind the itch, decode the symptoms, and arm you with practical tips for prevention and treatment. Because being pregnant is amazing and you deserve to enjoy every moment of it. Itch-free. Let's get down to the nitty-gritty. What exactly is a yeast infection? In simple terms, it's an overgrowth of a fungus called Candida albicans. This fungus is a normal resident of your vagina, usually kept in check by your body's natural defenses. However, pregnancy hormones, particularly estrogen, can disrupt this balance. Estrogen, while essential for a healthy pregnancy, can also increase glycogen levels in the vagina. Glycogen is like sugar for yeast, providing a feast that allows it to multiply rapidly. This overgrowth disrupts the natural pH balance of your vagina, leading to the uncomfortable symptoms of a yeast infection. But don't worry, this doesn't mean your body is failing you. It's simply adapting to the incredible demands of growing a human. Think of it as a temporary shift in the ecosystem of your body, a small price to pay for the miracle of life. And the good news is that yeast infections are easily treatable and preventable, allowing you to get back to enjoying your pregnancy journey. So how do you know if you have a yeast infection? Well, your body usually gives some pretty clear signals. The most common symptom is itching, and we're not talking about a gentle scratch. This is the kind of itch that makes you want to scratch your insides out. Don't worry, we've all been there. Along with the itching, you might experience burning, especially during urination or intercourse. You might also notice a change in your vaginal discharge. Instead of being clear and odorless, it might become thick, white, and clumpy, often described as resembling cottage cheese. Don't be alarmed by the visual, it's just your body's way of saying, hey, something's a bit off down here. Remember, every woman's body is different, and so are the symptoms. Some women experience mild discomfort while others have more severe symptoms. The important thing is to listen to your body and consult your doctor if you suspect something's not quite right. Early diagnosis and treatment are key to getting back to a comfortable and enjoyable pregnancy. Now that we know what causes yeast infections, let's talk about how to keep those pesky critters at bay. Prevention is always better than cure, especially during pregnancy. The good news is that a few simple lifestyle changes can make a world of difference. First and foremost, let's talk about underwear. Cotton is your new best friend. It's breathable and allows for better airflow, keeping your intimate area dry and less susceptible to yeast overgrowth. Avoid tight-fitting pants and synthetic underwear as they can trap moisture and create a breeding ground for yeast. Next up, hygiene. It's important to keep your vaginal area clean, but avoid harsh soaps and douching. These can disrupt the natural pH balance of your vagina, making it more prone to infections. Instead, opt for mild, unscented soaps and gently pat the area dry after washing. Remember, your vagina is a self-cleaning oven, so no need to go overboard with the cleaning. Suspecting a yeast infection? Don't panic. Your doctor can easily diagnose and treat it. They'll likely ask about your symptoms and may perform a pelvic exam to examine your vagina and vulva for signs of infection. This usually involves a quick and painless swab of the affected area to be examined under a microscope. Treatment for yeast infections during pregnancy typically involves antifungal medications, usually in the form of creams, ointments, or suppositories. These medications are safe for both you and your baby and work by targeting and eliminating the overgrowth of yeast. Your doctor will prescribe the appropriate medication and dosage based on your individual needs and the severity of your infection. It's crucial to complete the full course of medication as prescribed by your doctor, even if your symptoms improve before finishing the treatment. This ensures that the infection is completely cleared and reduces the risk of recurrence. If you have any concerns or questions about your medication, don't hesitate to reach out to your healthcare provider. They are your best resource for safe and effective treatment during pregnancy. You might have heard whispers about yeast infections affecting your baby during childbirth. It's true that babies can contract a yeast infection, known as thrush, from their mothers during delivery. Thrush usually appears as white patches on the baby's mouth, tongue, or cheeks. However, this is usually easily treatable with antifungal medication prescribed by your pediatrician. If you have a yeast infection during delivery, your doctor will take necessary precautions to minimize the risk of transmission to your baby. This might involve treating you with antifungal medication before delivery or treating your baby after birth. It's important to remember that thrush is a common and usually harmless condition in newborns. While it can be a bit uncomfortable for your little one, it's easily treatable and shouldn't cause any long-term problems. If you notice any white patches in your baby's mouth, don't hesitate to contact your pediatrician for guidance and treatment. Preventing yeast infections during pregnancy isn't just about treating the symptoms. It's about maintaining overall vaginal health. Just like you nourish your body with a healthy diet and exercise, your vaginal health also thrives on a little TLC. One of the simplest yet most effective ways to maintain vaginal health is to stay hydrated. Drinking plenty of water throughout the day helps flush out toxins and keeps your vaginal tissues healthy. Think of it as giving your body a refreshing internal shower. Another important aspect is maintaining a balanced diet. Limit your intake of sugary foods and drinks, as sugar can promote yeast overgrowth. Instead, focus on consuming plenty of fruits, vegetables, and whole grains, which provide essential nutrients for overall health, including vaginal health. Remember, a healthy gut equals a healthy vagina. While this essay provides helpful information about yeast infections during pregnancy, it's crucial to remember that it's not a substitute for professional medical advice. Every pregnancy is unique, and what works for one woman might not work for another. If you suspect you have a yeast infection or are experiencing any unusual vaginal symptoms, the best course of action is to consult your doctor. They can accurately diagnose the issue, rule out any other potential conditions, and recommend the safest and most effective treatment options for you and your baby. Your doctor is your trusted partner throughout your pregnancy journey. They are there to address your concerns, answer your questions, and provide personalized guidance based on your individual needs. Don't hesitate to reach out to them, no matter how small or insignificant you think your concern might be. Remember, there's no such thing as a silly question when it comes to your health and the health of your baby. Natural remedies. Exploring alternative options. Many women seek natural remedies to manage yeast infections during pregnancy, opting for a more holistic approach. While some natural remedies have shown promising results, it's crucial to consult your doctor before trying any alternative treatments, especially during pregnancy. One popular natural remedy is yogurt. Plain, unsweetened yogurt contains live cultures of lactobacillus bacteria, which can help restore the natural balance of bacteria in the vagina. You can apply plain yogurt topically to the affected area or consume it orally. Another natural remedy is coconut oil. Coconut oil possesses antifungal properties that can help combat yeast overgrowth. You can apply a small amount of virgin coconut oil topically to the affected area. However, it's important to note that coconut oil can weaken condoms, so it's best to use alternative barrier methods for contraception if you're using coconut oil for yeast infection relief. Debunking common yeast infection myths. Yeast infections are shrouded in myths and misconceptions, often leading to unnecessary worry and embarrassment. Let's debunk some of the most common myths surrounding yeast infections during pregnancy. Myth number 1. Yeast infections are sexually transmitted. This is false. While yeast infections can be passed through sexual contact, they are not considered a sexually transmitted infection, or STI. As we discussed earlier, yeast is a natural resident of the vagina, and hormonal changes during pregnancy are the primary culprit for overgrowth. Myth number 2. You can't get pregnant if you have a yeast infection. This is another myth. Yeast infections do not affect fertility or your ability to conceive. However, if you're trying to conceive and experiencing recurrent yeast infections, it's best to consult your doctor to rule out any underlying conditions that might be contributing to the infections. Finding relief and support. Dealing with a yeast infection during pregnancy can be uncomfortable, but remember, you're not alone. Millions of women experience this common pregnancy woe, and there's no shame in seeking relief and support. Start by talking to your partner, friends, or family members who have experienced pregnancy. They can offer empathy, understanding, and practical tips that have worked for them. Sharing your experience can help alleviate any feelings of isolation or embarrassment you might be experiencing. Online forums and support groups dedicated to pregnancy can also be valuable resources. Connecting with other expectant mothers going through similar experiences can provide a sense of community and reassurance. Remember, you're all in this together. Yeast infections, a temporary inconvenience. As we conclude our exploration of yeast infections during pregnancy, it's essential to remember that they are a common and treatable condition. While the itching and discomfort can be frustrating, they are temporary and manageable with the right approach. By understanding the causes, symptoms, and prevention strategies, you can navigate this common pregnancy woe with confidence. Remember to prioritize your vaginal health by practicing good hygiene, wearing breathable clothing, and maintaining a balanced diet. And most importantly, don't hesitate to reach out to your healthcare provider if you have any concerns or questions. They are your best resource for personalized guidance and support throughout your pregnancy journey. Remember, you've got this, Mama.